Thank you for choosing to join me today for our next 10-minute tips. I will attempt to keep to 10 minutes today as well, which is focusing on urine-specific gravity measurements in cats. The questions that I'm hoping to answer through this presentation are: when is a USG assessment helpful? How should we assess USG in our feline patients? How do we interpret the results that we get? And what, other than reduced kidney function, should we be thinking of as a potential cause for a reduction in USG? So that's my target for things to cover over the next 10 minutes, and then we'll have some time for question and discussions. So last time when I spoke about urine collection in cats, and if you weren't present for that, it's a recording which is on the video tutorial page of the website, so do feel free to look that up. But we talked about when a urinalysis was indicated, and this is just a reminder of those sorts of situations. So in other words, many occasions when collecting and analysing a urine sample is important, including sick cats, where we're specifically concerned or interested in renal function, where we have evidence of urinary tract disease, and as part of our pre-anaesthetic checks and wellness checks in older cats in particular, because we know, for example, that chronic kidney disease is very common. It probably affects at least a third of older cats, perhaps more than half of cats over the age of 15. And International Cat Care, a charity based in the UK, which many of you I'm sure will be familiar with, have updated their life stage guidelines for preventative health care of cats. And so just a very brief reminder of these, and the website that's I think is useful to look at specifically to do with this is what they call their Cat Care for Life website, which I've put the web address on this slide. So it's catcare and then a number 4 life.org. And as you'll see, the guidelines for preventative healthcare, so wellness checks in apparently healthy cats, are summarized on this slide. And if we just highlight when urinalysis is recommended, you can see it really starts from when the cat is 7 years old. So if possible, it's a useful thing to do. And by urinalysis in this context, the apparently healthy cat, we're really just talking about a dipstick and specific gravity. So not necessarily expensive or complicated tests, but just really a quick look for the obvious problems. So what does the urine-specific gravity tell us? Why is it a helpful thing to do? Well, firstly, what is it actually measuring? Well, it's a measure of urine concentration, and it gives us an estimate of the osmolality of the urine. And it's calculated by dividing the density of the urine by the density of distilled water. So when we calibrate our refractometer in the clinic, we calibrate it with distilled water, and then subsequently obviously wipe our refractometer, we put on a urine sample, and that refractometer can give us the density then of that urine sample relative to water. And a number of situations where that is helpful. Renal disease, obviously a very important one, as we've already mentioned, but also urinary tract cases, lower urinary tract disease, an important component of our feline pathology, if we like. It's often a common reason for presentation. And if we find in a cat with signs of lower urinary tract disease that their urine is very dilute, if the urine specific gravity is less than 1035, then one thing that should raise the possibility of in our minds is bacterial infection, because often bacterial infection is associated with underlying illnesses, which also are associated with a reduction in USG. But some urinary tract infections, such as E. coli, actually will interfere with the kidney's ability to concentrate the urine as well. So undoubtedly, assessing USG can give us helpful clues in many situations. So not just our kidney cases, but also our urinary cases. And going back to that earlier slide of when we might want to do a urinalysis, well, specifically thinking of USG, I think for all of these situations, there is an advantage for us to actually understand what the urine specific gravity is. It's going to help us with our decision making in that unwell cat or in that apparently healthy older cat, where we're trying to understand are there perhaps some hidden illnesses present in the cat. So next, how should we assess USG in our cats? Well, I guess the key message here, as you can see by the red X, is not to use a dipstick. So whilst many dipsticks, depending on how many reagent pads you have on the dipsticks that you use, will purport to measure USG, they are designed for human urine and they are notoriously unreliable when it comes to our feline samples. And even if the dipsticks you get say that they are veterinary designed, I would still say don't use the USG pad. Just it's not worth confusing yourself. So really, this is something that should be assessed with a refractometer. Probably every clinic has a refractometer of some sort. Some of you may have digital refractometers, which I've not included a picture of, and some of you may have veterinary refractometers, which I've not included a picture of. And there have been some publications looking at, whether there is an advantage to having a vet refractometer, whether there's an advantage to the digital refractometers. And from my assessment of the data in those paper and discussion with colleagues, I think there's no great advantage really to having, these perhaps more sophisticated sounding refractometers, and that a standard refractometer is perfectly adequate for our day-to-day use and day-to-day assessment. So the guidelines that I'm going to present to you are based really just on using that standard refractometer, which you all should have in your clinics as an absolute minimum. A couple of extra points just to make at this point would be, firstly, if your sample looks very turbid, if it looks very cloudy, then that can affect the USG, because the urine specific gravity is measuring solutes and anything really in that urine beyond water. So spinning it down and doing a specific gravity on the centrifuge sample would be sensible. And also you'll notice that your refractometer is calibrated or designed to be used at a certain temperature. So just check that if that is the case, you're doing your assessment at a temperature which your refractometer is designed to work at. So having put your drop of urine onto your refractometer, if you're using one of these very standard handheld units, you will then, having calibrated it and cleaned it, put your urine on and then lower your that little flap over to on your urine sample, and then look through the eyepiece, directing your refractometer towards the light, and you'll see this fluid line, this coloured line in this example here, very typical, where you can read off the specific gravity on the scale. So this cat has, so I'm just straining my eyes to look at it, but a USG between 1015 and 1020, for example. So how do we interpret the results that we get? Well, if the USG is greater than 1035 in a cat, that's a pretty normal result. And if that's an apparently healthy cat coming in for a preventative healthcare check, that's a nice result to hear, and we can sign that cat off from a renal perspective or urine perspective on very basic terms until the next assessment, unless, of course, there's any clinical reasons to worry about it, any weight loss, for example, that might want us to look in more detail at our patient. If the USG is between 1013 and 1035, then it is more concentrated than glomerular filtrate, but it is in this category where we would say it was minimally concentrated. So it is not what we would call an adequately concentrated urine sample from a cat's perspective. Now, there are some reasons why that might still be seen in an otherwise healthy cat. So for example, or a cat with healthy kidney function, let's say specifically. So for example, if the cat has had lots of IV or subcutaneous fluids, if it's received diuretic therapy, that of course can bring down the urine specific gravity. Also, if it's a cat that has a very liquid diet, perhaps it's got an esophageal stricture and it can only eat a liquid food. So we need to look at all those potential reasons for a reduction in USG. But if we've ruled those out, then this is in that minimally concentrated area, and renal disease is certainly a possibility, but there are other possibilities as well. As I've put here, the big two other ones would be diabetes and hypothyroidism. If our cat is dehydrated or azotemic, then again, it's definitely considered inappropriate and an indication that renal function is suboptimal. The next category is isostenuria, so USG between 1008 and 1012. That's the same concentration of the glomerular filtrate and very similar differential diagnoses to consider as those we've discussed for minimally concentrated urine. And then last category is hypostenuria, where the urine is actually more dilute than the glomerular filtrate. So it's not now a sort of typical renal case, a chronic kidney disease case, but it could be a cat, for example, with diabetes insipidus, and that is then creating this very watery hypostenuric urine. And these cats, as you might imagine, expected to be very polydipsic, otherwise they get dehydrated. So in summary, in terms of interpretation, a USG in a normal healthy cat often actually is above 1040. So although that 1035 cutoff is used for abnormality for most healthy cats, and particularly, of course, those cats on a dry diet, the USG is greater than that and can be as high as 1090 if you have a refractometer that allows you to measure that high. If your cat is dehydrated, then if its renal function is good, of course, you would expect the urine to be more concentrated. So typically that will push the USG above 1050. So if you have a dehydrated cat and its urine specific gravity is less than 1050, that always would make me a little bit worried of perhaps its renal function is not optimal, even if it's not as low as that 1035 cutoff. But for most of our diagnostic purposes, that cutoff of 1035 is a useful one to have in your mind as a normal for cats. So if the cat has a USG less than 1035, we need to consider perhaps benign reasons for that, such as the examples I just gave, the cat on a liquid diet, for example, or the cat on diuretics. But if those are not the case, then these are cats that typically we're worrying might have kidney disease, diabetes mellitus, or hypothyroidism. There are some things that can affect the USG artifactually. Well, because this is a fairly simple test in terms of chemistry, if there are solutes like glucose, if there are high amounts of protein in that urine sample, also radiographic contrast material, then that can elevate the USG. And this is one reason why in diabetic cats, even those that are very polyuric and polydipsic, often their urine-specific gravity when their diabetes is uncontrolled is higher than you might expect. So it may be 1030, even though the cat's producing liters of urine a day. So that's because of the artifactual impact of the glucose on that urine-specific gravity. Also, just on the off chance that anyone from Japan ever chooses to log into this webinar, listen to this webinar, their refractometers are different. They're designed, the human refractometers are designed for the Japanese population. They have a slightly different measurements, and therefore it is known from some studies that have been done, we need to use a different cutoff point for our cats if using a Japanese refractometer, which is 1046. So if you find you have a USG less than 1035, and in particular, if you're looking at an apparently healthy older cat, what should you do next? What's the next piece of advice? Well, first thing is to consider those physiological and iatrogenic reasons for a reduction in USG, and make sure that you can rule those out before becoming concerned about the possibility of underlying disease. Of course, if there are other clues of underlying disease, for example, the cat's lost weight, you don't need to necessarily justify doing further investigations. But if everything looks fine, you just want to check, well, what is the cat's diet? How much cat milk or tuna juice do you think you give to your cat a day, for example? Then from a pathological perspective, the top three, as we've emphasized, are kidneys, thyroid, and diabetes mellitus. And so as the initial next step would be do a dipstick, look for glucose for a start, because that might be helpful in the diagnosis of diabetes. But this, in my view, is also justification, if not already being recommended, for some blood tests, which ideally not only include our renal parameters, but if possible, a total T4 as well. So in summary, USG, quick and easy to measure. We just need to remember a few things which might influence our results, and remember to calibrate our refractometers. Things like that can sometimes get forgotten in the busy day-to-day practice life. And I think use whatever opportunities you can to collect urine samples and test them for USG. In the healthy older cat, I think it's a really helpful early detection system for renal disease, for example, but also often other conditions such as hypothyroidism hypothyroidism, diabetes mellitus, and helps to progress our cases in terms of further diagnosis. So I hope that's been useful. This is just a reminder of some of the resources on the website. So we have got technical guides in the helpful info free download section that would complement this presentation. Also in the video tutorial page, there is now a recording of last time's webinar, which was on urine collection in cats, but there's also a number of other videos on practical techniques, blood pressure measurement, so on and so forth. There is some CPD, some books on the website as well. And if you would like a copy of these slides, or you have questions which we're not able to answer in just a moment, then please do feel free to send an email through. And just finally, a little plug for next time's session, which is a bit of a challenge in 10 minutes, but how to manage feline idiopathic or stress cystitis. So I hope you'll be able to join me for that, or perhaps view the recording after the event. Thank you very much.